today we're going to talk about the lower leg and ankle dorsiflexion, so the ability of the foot to come towards the shin, as well as knee rotation, which is something that's commonly ignored in a lot of sports, but really important in that lower leg function, especially in running through that mid stance, so that we're able to get that dorsiflexion through the ankle without our knee collapsing. So being able to rotate through that shin. So we're going to start with just a little test so that you can see where your range of motion is. So you'll just need a wall, and you're going to be in a half kneeling position, so kind of 90 degrees for both knees and hips. And then keeping our hips square and our foot flat, so that tripod position. We're going to lunge forward until our knee touches the wall. If our knee is able to touch the wall without our heel coming up, then I want you to wiggle back maybe half a centimeter, no more, and then try again. And we're trying to find the range where we can keep our foot on the floor, but our knee still touches. Again, making sure our hips stay square so we're not rotating, staying nice and tall, and then keep wiggling back until you can't get any more range. And then you're going to measure the distance between your big toe and the wall. So if your heel's coming up, then just wiggle forward until you can get that knee touch with your foot flat. And we'll try the other side, same thing. Find that tripod first, keep the hips square, lunging forward, knee touches. I'll wiggle back a little bit. Make sure I find my tripod again before I lunge forward. And just find our ankle. Ideally, we're at least 4 inches or 10 centimeters away to have good ankle mobility to be able to run. And we want to try and make them equal side to side. Where you feel the restriction is important as well. If you feel it on the back of the calf, and that's preventing you from going further, then the next drill that I'm going to show you will help with that. If you feel it more in the front, like a pinchiness, you might need a little bit of manual therapy to help get that joint moving a little bit better. So that's called closing angle pain. And anytime we get that pinching sensation, that's when most of the time stretching or mobility exercises are not necessarily going to help it, and we might need a little bit more support from a professional. So once you've done your test, take note of that down so that you can retest after you do the exercises, and then also week to week as you progress, and see if you can improve them. So we're going to start, before we do our ankle mobility drill, we're going to start with that knee rotation to try and unlock the knee so that it can work well with the ankle. So you're going to start on the floor with your knee bent at about 90 degrees and your heel on the floor where it can rotate. So I want you to imagine there's a screw coming out of your heel and it's kind of glued to the floor. You're going to bring your foot towards your shin, because the tendency is to want to move through the ankle for this drill. So I want you to lock out the ankle by bringing your foot towards your shin, so you should feel that engagement in the front of the shin. And then from here, you're going to think about rotating through the knee. So imagine an arrow coming out of that bony part on the front of your knee. And right now it's pointing forward, and you're going to rotate through that screw to rotate it to the outside, and then come back, and then try and rotate it to the inside. And for most of us, we have more limitation going in, so don't worry that it's not equal side to side. You're just trying to get as much rotation as you can without compensating through the ankle or compensating through the hip, so collapsing there. So staying nice and still through the hip and ankle, and we're getting that rotation through the knee. And you can even use your hands for support, so if you feel a little bit more restricted going internally, you can use your hand to try and encourage little bit more rotation in. All right. So we'll try that on the other side. So again, thinking of that heel as our pivot point, find that bony prominence in the front of the knee, foot up towards the shin to lock the ankle, and then we're coming out as much as we can and rotating in. If we're limited in knee rotation, it can cause a little bit more stress through the structures of the knee. So the meniscus and the cartilage of the knee. So we want to make sure that we have good rotation so that rotation can occur without that kind of twisting sensation. We're able to control the rotation versus having kind of compression and torque through the knee. So this is a great one to do with your ankle mobility work or before your runs, or if you're doing any squatting patterning, that kind of stuff, you can do some of these before that. So now we're going to work into our ankle dorsiflexion. So we're back in that half kneeling position. And you can use the wall for a little bit of guidance, or you can go into our combat position where you're sitting on your heels. But this isn't comfortable for everyone, so find the position that works for you. But the goal here is to maintain that tripod, nice spread toes, and then lunging forward until our heel wants to come off the ground, but we're able to control it. So I'm keeping my hips square. I'm going to hold this position, maybe oscillate a little bit. So think about wiggling in the joint back and forth. See if I can get a little bit more through the range before I start my contractions. So from here, I'm going to push my foot into the floor as if it's a gas pedal. So I go into plantar flexion, but the floor is resisting me. So I'm not pushing straight down. I'm thinking about pushing through the ball of my foot as if I want to try and push my foot through the floor. I'm keeping my heel down though, so I want to stay at end range. And then I'm going to reverse. I'm going to think about pulling my foot up towards my shin down towards my foot. So I'm thinking about lifting in this position without actually moving. So again, that engagement on the front of the shin. Good, and then relax. See if you can sink a little bit deeper. Feel free to oscillate a little bit. Wiggle back and forth. And then we're going to do that 3 to 5 times on each side. So you can switch over to the other side. Again, finding that nice toe spread, finding that tripod of the foot, lunging forward as far as I can. Again, you can use the wall for support, but for the drill, you don't need to keep your knee to the wall. Just making sure that heel stays down. And then I'm pressing through the ball of the foot, not the toes. I'm not crunching my toes, I'm pushing through the forefoot. So the front of the foot, the ball of the foot, pushing down, holding for 10, and then lifting up. So ankle dorsiflexion is really important for runners. Again, it's the foundation of what contacts the floor first. So if we have limited movement through our ankle, then our knee has to compensate by over flexing, which can cause patellofemoral issues or patellar tendon issues. We could also compensate if we don't have good ankle dorsiflexion by twisting through our trunk or our hip, again leading to medial knee pain or lateral hip pain. And then the other thing that I often see, because the ankle is a weight-bearing joint, our passive range, so the range that we move with support, is a lot more than our active range. So we often find if we don't have good active to passive ratio, that's when we can have some stress injuries as well. So common thing if we don't have good ankle dorsiflexion actively is we get shin pain. So we get either anterior shin splints because that tibialis anterior, that muscle in the front of the shin, is working harder than it has the capacity for, or we can even get medial shin splints because we're not able to actively pull our foot into that position, so the posterior tissue is loaded